Hello, and welcome to the Monarch eTNS System Quick Start Video Guide. The Monarch External Trigeminal Nerve Stimulation eTNS System is indicated for treatment of pediatric attention deficit hyperactivity disorder, ADHD, as a monotherapy in patients ages 7 through 12 years old who are not currently taking prescription ADHD medications. The device is to be used for patient treatment by prescription only, and is intended to be used in the home under the supervision of a caregiver during periods of sleep. In this video, we will go through step-by-step instructions on how to set up and operate the Monarch eTNS system. Important information regarding how to use the device safely and effectively is provided in the instructions for use. Please review this manual prior to using the device. Additional information is also available on the Monarch website at www.monarch-etns.com. Let's begin. The Monarch eTNS system is a non-invasive medical device that provides therapeutic stimulation of the trigeminal nerve in the forehead. The system comes with everything you need to deliver therapy and a 4-week supply of the disposable patches. The system components are 1. The external pulse generator. 2. 4 pouches of disposable NS2 electric patches. Each pouch contains 7 patches, a 1-week supply. 3. A battery charging station, AC adapter, and 2 rechargeable lithium polymer batteries. 4. 2 lead wires. 5. 1 instruction manual. Now that we have identified the Monarch eTNS system components, we are ready to begin using the device. Start by inserting a fully charged battery into the device. You will know that the battery is fully charged when the light next to it on the charging station turns from red to green. Please also verify that the switch on the side of the charging station is set to Li-ion prior to charging a battery. Please only use the batteries that are provided with the system, or the device may not properly deliver therapy. After inserting a fully charged battery, clean the skin of the child's forehead with soap and water or an alcohol-based wipe, and then dry his or her skin. Make sure that you cleanse and wipe your child's forehead before applying a patch. Failure to do so may result in the patch moving out of position or falling off. Remove the paper backing from the electric patch. Then, using a mirror to help, apply the patch to the center of the child's forehead, just above the eyebrows. The child needs to wear a patch even when testing the machine. If the patch is not worn and connected to the machine during testing, an error message will appear on the screen when trying to increase or decrease the current. The patches are single-use only and may not be used for multiple treatment sessions. Connect the lead wire to the 2 connectors on the patch. The lead wire has 2 connection prongs, one black and one red. It isn't important which colors on the lead wire are used. Simply connect one to each of the patch connectors. Insert the lead wire plug into one of the ports on top of the device. There are 2 ports, channel 1 and channel 2. You can plug the lead wire into either port, but for the easiest setup, use channel 1. When positioning the device at night, make sure that all the connections are secure. If a connection becomes loose, the device will stop delivering therapy. You are now ready to start using the device. First, press the on-off key. The LCD screen will flash NeuroSigma 3 times, followed by eTNS. Next, press any of the blue keys, up, down, select, or set. This will take you to the password screen. If the password is entered before the password screen appears, the device will not accept it, and you will not be able to start a treatment session. Once the screen displays password, enter the password by pressing the blue keys in the correct sequence. The sequence is select, up arrow, down arrow, set. You are now at the programming screen. Notice the default channel 1 is flashing. If the lead wire has been put in the channel 2 port at the top of the device, then you must use the select button to select channel 2. Once you have selected the proper channel, you may begin administering therapy. Step 8. With the proper channel selected, Press the up arrow to slowly increase the current. The current will increase in increments of 0.2 milliamps. You should slowly increase the current to a level that your child can feel it, but that is not painful. Important: the Monarch eTNS system is designed to stimulate the trigeminal nerve in 30-second cycles. In other words, the device provides electrical stimulation for 30 seconds and then rests for 30 seconds. During the 30-second rest period, you will not be able to increase the current. During the rest period, the device will say up arrow invalid to indicate that you cannot increase the current. Once the device turns back on, you are free to increase the current again. Step 9. When you have reached a comfortable level of current, hold down the lock button for 2 seconds. Once the device is locked, the other buttons will be disabled. This feature helps prevent you or your child from accidentally shutting off the device or changing the therapy during sleep. The device is now set and will deliver therapy until stopped. The Monarch eTNS system is intended to be used during periods of sleep for at least 8 hours. Simply place the device in a convenient position and your child can sleep as normal. When your child wakes up and is ready to stop therapy, hold down the lock button for 2 seconds. This will unlock the device and allow you to turn off the power. The final step is to remove the patch and store the device until the next treatment session. Important: if a connection comes loose or the patch does not achieve good contact with the skin of the forehead, then an error message will be displayed on the screen. If you see an error message, please turn off the device and carefully check all of the connections, including the contact of the patch on the forehead. Once the connections are secure, simply turn the device on and go through the programming procedure explained in this video. Important safety information. Contraindications. The Monarch eTNS system should not be used by patients with implanted cardiac and/or neurostimulation systems, implanted metallic or electronic device in their head. Warnings. Children 7 to 12 years receiving eTNS treatment should be closely supervised by an adult who has read the user manual and is familiar with the Monarch eTNS system. The Monarch eTNS system should only be used by the individual for whom it is intended, only be used with the guidance of a licensed physician, or be used with caution in patients with heart disease or serious medical disorders. Be kept out of reach of infants and children under the age of 7 years. Be used only as directed and be applied to healthy, clean, intact skin. Not be used with other electronic therapeutic devices. Not be applied to the neck or chest. Not be used in the presence of electric monitoring equipment, e.g. cardiac monitors. Not be used in the bath or shower. Not be used while operating machinery. The Monarch electric patches should not be used in patients with dermatitis or sensitive skin, as they are at higher risk of developing irritation, or be removed carelessly as this may damage the skin. The Monarch lead wires should not be allowed to wrap around the neck. Do not attach the electric patches anywhere on the body other than the forehead, on the neck, on the chest, over a defect in the skull, i.e. post-brain surgery. For full safety information, please consult the instructions for use included with the Monarch eTNS system, or visit www.monarch-etns.com/safety.